I think there's a lot of nonverbal and verbal cues that the preceptor can give the orientee, and a lot of the things that we talk about trying to discern what someone's motives are, if they're truly trying to help you, push you into an uncomfortable situation for your own benefit versus pushing you into that situation because they could care less and they just want you off their hands. And I think nonverbal can sometimes make the difference. I would hope that a preceptor would never huff and sigh or show other, even nonverbal cues of "I don't want to be with you today." And this can happen whether they just see you coming in and you can tell by their face. I think it can affect the dynamics of the unit to have someone who, even if you have someone who hates their job, period, when they come in, they bring you down. So to have someone who hates precepting and then to have the orientee there, it's really awkward. Sometimes it might be because they were pushed into it or they felt obligated to do it. And sometimes it might be because they've been doing it for too long without a break and they're burnt out. But in either circumstance, they deserve a break, or maybe maybe precepting isn't their thing. But I would hope that management would support that decision to not have them precept, rather than keep them precepting with an attitude of "I hate this." As a preceptor, you would even tell your manager, "Hey, you know what, I would like to take a break for a while. I'm getting overwhelmed myself." So it's really hard to convey a positive attitude with an orientee when you're on the verge of burnout yourself. So as a preceptor, just knowing when to say when and taking a break and being willing to say, "Hey, you know what, I'm not ready for this right now."
Find out more at realityrn.com.